Hey guys, this is Dr. Hub. Today we'll look at the Hodgkins lymphoma, and under Hodgkins lymphoma we'll look at some features as well as the different types. So to get started, first we look at the non-sclerosing nodular sclerosing variety, nodular sclerosis. This is the most common, it's MC, that is the most common type of the Hodgkins lymphoma. Then what about the gender basis? Comparing the gender, the male is equal to the female. Then what about the age? The age is that the adolescent and the young adult. Next we look at how is the RS cell. So the RS cell here, it is a lacunar. It is lacunar variant, and there is also some space. There is presence of clear space. There is clear space surrounding the cell. So there is lacunar variant having a clear space surrounding the cell. Next. So in terms of markers, it is CD plus CD 15 plus as well as the CD 30 plus. And what about the EBV? EBV is uncommon, as well as it is usually not associated. It is not associated usually. So what about the prognosis of this nodular sclerosis? Prognosis is excellent. Next, we will look at the mixed cellularity. So here it is most common type, and this is specific to India, and the male is greater than the female in distribution. Then age, if you see, it is biphasic. So mixed cellularity is biphasic, that is young adults as well as it is present in young adults as well as a greater than 55 years. So it is present in young adults as well as greater than 55 years. Next we look at the RS cell. So RS cell in mixed has eosinophil as well as plasma cells, that is EP cells. So there is presence of the eosinophils as well as there is presence of the plasma cells. There is presence of the plasma cells. And there are maximum number of RS cells. There is maximum RS cells. Next, we move on to the markers of the mixed cellularity. So markers, if you see, it includes the CD15 plus as well as the CD30 plus. And next we look at the EBV. In terms of EBV, it is associated. EBV is associated. And what about the prognosis? In case of nodular, it was excellent. Here it is very good. Now let's look at the next variety, that is a lymphocyte rich. So in case of the lymphocyte rich, it is the male which is greater than the female. So the males have this disease more common than the females. And what about the age group? The age, if you see, it is present in the old age. And next we look at the RS cell. The RS cell, it is nothing but a mononuclear variant of RS. It is a mononuclear variant, and this is of the RS, and there is a lowest number of RS cell. There is a lowest number of the RS cells. Next, let's look at the markers. The markers it is CD15 plus as well as CD30 plus. Next comes the EBV, whether it is associated. The answer is yes, it is associated. And now we look at the prognosis. So what is the prognosis here? The prognosis is from good to excellent. Prognosis is nothing but it is good to excellent. Next we look at the lymphocyte depleted. So how is lymphocyte depleted? So in terms of the lymphocyte depleted, it is mainly HIV associated. It is HIV associated, and here the male is greater than the female. The age is, it is present in the old age. And what about the RS cells? Comparing the RS cells, it is there is a pleomorphic. It is pleomorphic, as well as it has necrobiotic, or it is a muffled variant, mummified variant, and this is going to be of the RS cell. And there is a maximum area of necrosis. Maximum area of the necrosis. So this occurs in the lymphocyte depleted. Then we look at the EBV. So when you're looking at EBV, it is associated. And let's look at prognosis. Prognosis of the lymphocyte depleted is going to be poor. Lastly, we move on to the predominant. That is a non-classical. Predominant is nothing but non-classical HL. So here the M is greater than F, that is the male is greater than the female. It is more common in the young males. It's more common in the young males. Then we look at the RS categories. So in terms of the RS, it is the LH cells. There is LH cells, and this is nothing but the popcorn cells. And they are present in the background. Next, there are other cells which are scanty. So it contains the other cells, and these cells are nothing but it is scanty. And the B cells, if you see, they are absent. Now let's look at the markers. The markers are a bit different here. This is the predominant non-classical HL. So it is CD15 minus, CD30 minus, and CD20 plus. There is also the BCL6 plus, EMA plus. So what about EBV? So here it is EBV not associated. It is not associated with the EBV. And what about the prognosis? Prognosis here is considered to be excellent. Then now we move on to the classical subtypes. So what are the classical subtypes? The classical subtypes, it includes, there is a nodular, there is presence of the nodular sclerosis. Next, there is also mixed cellularity. Then comes the lymphocyte rich, as well as there is lymphocyte depletion. Now let's move on to the non-classical subtype. So under the non-classical subtype, it is going to be the lymphocyte. It is a lymphocyte which is predominant. Lymphocyte predominant, and there is a mixed cellularity is more common associated with the HIV. Other thing to note is that the mixed cellularity, it is most commonly associated with the HIV. This is due to the high incidence.